This is a conversation with Dr. Ethan Perlstein, a scientist and biotech founder who's reimagining how we discover treatments for rare diseases. He founded Perlara, a YC-backed public benefit corp, and now he leads Curetopia, a decentralized nonprofit using blockchain to repurpose drugs. We talk about the post-academic collapse in science careers, why most rare diseases are financially abandoned, and how crypto and AI might reshape drug discovery. This is the Acc Podcast. Please enjoy.
It's really a big pleasure to have you. Yeah, I just want to get started right away here. You've spoken before about the post-docalypse, which is hilarious. I'm in an academic lab right now, so if I told that to one of my postdocs, they would definitely agree. You got your PhD from Harvard, you did a fellowship at Princeton, and you still hit a wall with academia. My professor, she was basically saying that, there are those who I encourage to stay in academia, and then those who I encourage them to go into industry. Maybe they're not cut out for it. I'll tell them to go to industry. Can you just kind of walk us through what that turning point looked like for you, and how did it feel to step off that academic treadmill?
Yeah, I guess it pains me to hear that people still have this very trad sci view of industry, of entrepreneurship, of startups and biotech. I mean, you probably listened to the Acc Podcast. He just had George Church on. I think George Church single-handedly has created the field of synthetic biology, and all of his apostles and trainees have gone on to found lots of interesting companies. And so the fact that nobody questions his science, and yet people still quietly harbor these antiquated views about, what is it, selling your soul or going to the dark side or whatever. That's what people used to say back in the day. The trainees and such that I encounter on X and Twitter are still, open to the idea that you could do science outside of the ivory tower. So yeah, I hope that becoming a founder in biotech, coming from a PhD or coming from a postdoc, has been normalized in the 13 years since I posted that Post-docalypse now screed. But yeah, things change slowly in academia. But just the other day, open access was mandated for the first time with NIH-funded publications. It's crazy how long it takes for things to change, which is also why startups is a natural place for me, because it's just so much more dynamic and things can just be built and things can just happen without a committee or without.
Totally. And I think in today's day and age for academic funding, especially at Harvard, we're having some difficulties.
And that's just insane. Yeah. Like I've seen David Sinclair's tweets. It kind of boggles the mind why we would shoot ourselves in the foot here. But hopefully that will, the politics will work itself out. There is resilience to these institutions and to these scientists. So it sucks to see the disruptions. There's contractions, companies dying, companies that raised a bunch during the heydays.
Yeah. Speaking of industry and speaking of fundraising, your very first venture, Perlara, that was a rare disease drug discovery startup, and it was a public benefit corporation. And that's very unusual in biotech. So talk to me about the differences between a PBC and a C Corp, both in theory, and I'm actually more interested in the differences executionally and why you chose that for your company, because it's easy to say we're gonna have the patients in mind and we're also profit driven, or not profit driven, but these two incentives are a 50-50 for us. But what does that actually mean?
Perlara, I still talk about in the present tense. It's still a going concern after, it's in its 12th year now. Biotech takes a long time to cook. Platforms take a long time to cook. So it's still yet to be seen. The next chapters for Perlara: find product market fit, lose it, find it again. So that's just the nature of staying alive as a company. I hope that all of our accumulated learnings will at some point materialize into successful drug development. We saw a pipeline that was patient driven. And I set up Perlara as a PBC way back in the day, 2014. And that was definitely seen as an oddity. Since then, there have been some biotech PBCs, Mark Cuban's Cost Plus drug company is a PBC. I've heard noises of companies here and there that are PBCs, but yeah, it didn't take off like wildfire. And because, as you say, executionally, like you can be a vanilla C Corp and still act like a PBC. And so you don't really get any really concrete benefits to being legally set up as a PBC. And a PBC is still viewed as just another type of Delaware C Corp. So, in practice, it was a lot of marketing and talking about being a PBC, and functionally it was not all that different under the hood. And, so that's probably partly why it hasn't really taken off, because it doesn't really solve any major pain points. So I think where I've come in my evolution is that the intent of wanting to put patients first and to build with patients, and not just to build around them or on top of them, but to build with them. I think having run the experiment now for over a decade, I'd say being a PBC right now, it doesn't really matter. It doesn't mean anything. If your cap table is still basically just the same old folks and it's not patients and so forth and other types of stakeholders. So I think for me, the PBC experiment kind of has, it's still running its course with Prolara, and it's still kind of a blank slate and what will be made of it. But I would say, the PBC structure in biotech, I'm not sure it's going to really ever catch fire. And I think one of the structural reason for that, and it's because if you adopt the PBC type orientation, you do what we did at Prolara, you partner with these really entrepreneurial families, you still at the end of the day have very kind of binary risk. And, that was proven out with Maggie's Pearl. This is a joint venture that Prolara spun out with the family. And that was always kind of the objective of Prolara, was to spin out these joint ventures with families and prove we could build kind of family run biotechs, do it a different way. But at the end of the day, like any other company, we had essentially enough capital to fund one asset, and there was a 0-1 outcome. And our phase 3 didn't work. And there were a lot of learnings, and we can recycle those learnings, but we didn't get the one. And so that means there wasn't really value created there. You're in this pickle most of the time as a platform, companies to kind of thread this needle here. And so I think, long story short, when you run this PBC model in biotech, you end up kind of selecting for certain types of families. And unless you're really working with billionaires, then you're going to essentially kind of be set up to be a lead asset and one shot goal. And if it doesn't work, you're kind of back to square one. So I think, but what I learned from all that experience with Maggie's Pearl and with continuation of Prolara as it evolves was that I think we need to do something completely different. And that kind of led me to Curetopia, which is my third company, and is what I call sort of a crypto biotech. And we can unpack what that means. I think by building on chain and by doing this radical type of break with the traditional model, the trad bio model, then I think we can actually go back to that original mission of really putting patients center, building with patients, not on top of patients. And that's what kind of Curetopia is, this new vessel for that PBC spirit. I've now taken my energies toward this new frontier, which is crypto biotech.
Yeah, totally. I've noticed that with PBCs, there's like this initial burst of energy around mission, alignment, and values, which can be great for storytelling, right? And attracting early partners. But then I've also heard founders say that unless the business fundamentals are right, and unless that lead asset, actually, that's the important thing at the end of the day, right? Have you ever been kept up at night thinking about what could have happened if you let go of your asset with Prolara earlier on? Do you ever think about, just from a financial perspective, does that keep you up at night ever?
That I should have let the company go?
No, just was it always your idea that you want to drive this home and you want to bring it all the way to market?
I see. No, I think, yeah, you can kind of do this build to buy thing in biotech and just sort of work your way up through the system. I just didn't see the point in that. I thought if you're going to put all your energy into a startup, you may as well try to make it a generational company. In biotech, it's a long journey. It's a lot longer than in software and in AI. So hopefully AI, where it is now, is going to make that journey actually faster, but still it takes time. So yeah, I kind of view things as lifelong projects, tackling problems where it becomes your life's work. And so, yeah, whether that's ultimately be realized with Prolara, there was an opportunity where when the company sort of didn't raise additional financing and we sort of quote unquote ran out of money, it could have sort of died, and I didn't let it die, and was counseled by many to just be like, all right, well, great, you notched your failure, great. Now you can kind of claim that you're experienced and now you're more investable anyway as founder, CEO, et cetera. And I just didn't really buy into that narrative and thought, this is my intent here was to really tackle something really big, rare diseases, still focusing on that problem. 3 companies later, still trying to tackle the same exact problem. And so I think the greatest founders I've ever looked toward have always made some big problem their life's work. And whether it's the first version of their company, a different they just keep at this gnawing problem. I haven't notched the victory yet in terms of getting over the finish line with a developed commercial drug, but that's still why I'm in the game. That's why I still get up every day. Where I'm thinking about, one of the things I'm thinking about as I'm going to sleep is how to make that a reality. I think rare disease is such an important problem to solve that you're not just going to get it in one shot, one company, one asset, and you're done.
Yeah, totally. I feel like there's a lot of players in biotech, especially because it is such a long journey and it's so capital intensive that people are in it for the wrong reasons. A lot of the times, people pumping and dumping their stock and just like people doing crazy things, taking a salary. And then you're like, this is all I want out of this. I don't really want to do anything for the public good. I think that's more ubiquitous in biotech, actually, than in software, because software, fast outcomes, right? Everything moves super fast. You can exit really fast. And that's just not true about biotech. You have to be in it for the long run. And sometimes the wrong people get in it and their incentives are not aligned with just the innate difficulty of being in biotech.
There's examples of, I would call it good behavior, bad behavior on the investor side, on the founder side. People pumping certain companies or taking companies public or whatever. There's behavior that happens in a boom. There's behavior that happens in the crash period, in the winter. So I'm definitely known for saucy takes, but I would say I like to also just be, just sort of call them like I see them, and that nobody here is privileged. I think maybe biotech folks tend to have, I could perceive what you might, at least compared to tech, like a superiority complex, because it's like, well, I'm not building something, I'm making medicines, I'm saving lives. And I don't think every, biotech person or biopharma person is sort of thinking, wow, I'm so superior to these techies or these crypto people or whatever, people making money on memes or frivolous things. I'm making medicines. I think a lot of people think that in a good way, like, yeah, I could be spending my time on frivolous things and I'm working on something much more important. I like that part of biotech. It can go to a bad place. And obviously, yeah, with massive compensation packages and companies that get kind of, fewer companies get bigger rounds, and those are led by teams who've done it before, who are expecting more and more comp. Like, yeah, it's sort of like, once you kind of break into that biotech club, you basically are now, you're a made person and you're kind of a made CEO. And whether your company fails here or there, people are like, that's fine. At least you kind of, pay your dues. And whereas in tech, they realize because you can pivot and the cycle times are faster, there's many reasons why you see the difference in the founder age ultimately between tech and bio. But yeah, I would say ultimately both have their excesses and both have their virtues. And ultimately, like, I just want to kind of promote the idea of being, a responsible, ethical kind of builder and founder, and aligning yourself with the right investors, not taking money from just anybody. Founders have a lot of agency that they tend to forget they have because they're just so caught up in the moment of fundraising or caught up in just the performance of what they think being a CEO is.
Yeah, totally. Same page. Okay, I wanted to talk about what you actually do, which is work on rare diseases. I hear people say orphan disease and rare disease pretty interchangeably. And so I know orphan diseases get a lot of special treatment by the FDA, right? They can be like fast tracked, they can be considered for accelerated approval. And for viewers who aren't familiar, that's basically to just skip phase 3 trials altogether and go straight to market. They get more exclusivity, right? Tax credits potentially. And so I would think that investors would be all over that. Easy regulatory, why is that not financially attractive? But you've cited that you tried raising money the traditional way and raising from VCs, and you said that they didn't really see value in what you were doing. And just given what I know about the regulatory for this, I just wanted to ask you, why? Why were traditional investors not seeing value in that? And I assume and we'll lead up to that, why you decided to start Qtopia.
There's always been smart money in biotech that kind of got rare and, was able to build really successful businesses, BioMarin, Ultragenics, you look at Bridge Bio, and those were like really strong founder-led companies. That's another common theme here. So I do think that the people have understood that you can have a faster path with rare, but I think ultimately, especially since the GLP-1s have come online, and pharma has seen that the global blockbuster is alive and well again, then it just, you're going to make frankly more money being the fifth or sixth GLP-1 competitor than you will ever sitting developing an orphan drug for the most part. And now with like thoughts about just combinations with GLP-1s and other mechanisms to get the next generation, third generation, so forth, like you're just going to see this upsuck where blockbuster is king again. And so most of the money is going to kind of chase after those opportunities, I think. So it's not helpful that like the priority review voucher program has lapsed and is sort of in limbo, which was an incentive to develop ultra rare drugs, kind of set a price floor for developing an ultra rare asset else in the community. That's kind of gone now. So yeah, I still think there will be smart money in trad bio that sees the rare opportunity. We'll see what happens with this plausible mechanism framework that FDA is talking about and how that might apply. Skipping phase 3, but just reimagining trial looks like, not the two-dimensional, double-blind, placebo-controlled, randomized. That's one size fits all that doesn't work. That's been the deathbed of many, many ultra-rare drug developers who have not been able to manage the gauntlet. So if there's a more streamlined path, and if there's ways to get to value quicker with rare, then I think that there's plenty of capital that would come back in. But I just think there's too many other attractive, frankly, larger diseases. And then if you're looking at rare and you're just thinking, well, this disease has 1,000 patients, this one has 2,000. Like, every team is going to eventually say, well, I'm incentivized to go after the bigger market. And then at some point, well, there's actually this other disease that's 3,000. Well, then sorry, 2,000. And then so if you only have really classic ultra orphan, couple hundred in the US, they're just like, why bother? If like you have to spend the same amount of money basically, and you could work with a population that's 10 times bigger, avoid some of the sticker shock of having to price such a drug really high because there's so few patients, like you could just see how the system just will start to gradually shift away from the ultra orphans. So there's got to be another way to finance that long tail of rare diseases because it's not going away.
Yeah, that's a really good point about the different levels of rare, and the most rare basically get virtually ignored because the capital costs are near identical or very similar between.
Or there's just a fixed minimum that they can't get more efficient. And so if you're going to end up having to spend, no one can kind of spend less than, TradBio can't do a clinical study for less than $100 million, then you're like, well, I have to make the math work with the number of patients. And if there's 10 times more patients, maybe I can price my drug 10 times less. So you just sort of, this is the reality of how that the long tail just simply gets abandoned.
Yeah, totally. And on that note, your current company, Curetopia, it's structured as a nonprofit, decentralized, autonomous organization, raising funds using crypto to pursue repurposed drug candidates. And so just to those in our audience who might not be familiar with this concept of decentralized science, it's a way of coordinating science research, funding, IP, decision-making across a distributed community, often using blockchain to replace pharma, VCs, or academic institutions with community-governed protocols. And so let's just dive straight into that. Would you classify your company as a biotech startup, a crypto startup? Which one of those do you think makes more sense? And is the key innovation here the business model? Because repurposing drugs, in my view, it's like a known regulatory hack, right, in the biotech ecosystem, certainly with huge potential benefits to patients. So maybe just talk to me a little bit more about Curetopia, the core innovation behind it, and your personal mission for it.
Yeah, it's a startup at the end of the day. I think DAOs and community governed protocols, this is the ideal, but we're going to kind of build to it in transition steps. And the transition steps, will have some features of the current system, and then we'll have some features of this ideal system. Depending on marketing and audience, you can call it a slightly different thing. But at the end of the day, it's a biotech startup and it's built on chain, because the crypto part will have various triggers and meanings. But the blockchain part is really the part that is the tech under the hood that provides the capital efficiencies, helps solve these coordination problems, helps for actual governance rights to be distributed, fractionalized, and then allow for upside to flow into a treasury and to the holders of the token. in exchange for them providing utility like data or other things that make the biotech enterprise go. So yeah, at this stage in the game, the auction that we launched on Solana closed out um, a little under 4 months ago. And we raised at the time just under $2 million. And where price the sold is today, actually, we're a little bit above that closing auction price. So it's kind of nice to see a balance sheet in biotech actually grow a little bit over time, not just to wither away and burn, which is like I've seen almost every other biotech out there. So I think, obviously, when you're attached to crypto, your treasury is denominated in a cryptocurrency. There's a lot of volatility than if your treasury is denominated in just dollars sitting in a vanilla bank account somewhere. But at the end of the day, we're doing elements of a DAO and governance where it makes sense. But we're also realizing that we can't just score a win for DeSci in the Web3 ecosystem alone. We have to bridge to pharma, to the bio equivalent of Web2. So I think what I'm optimizing for Utopia is, really getting pharma and the mainstream trad bio to kind of buy in on blockchain, and not the crypto financing part, because that's the scary part. It's actually the safe part, the more stable part, which is the blockchain tech, and using these tokens, utility tokens, as a way to incentivize community participation, data sharing. We can then track research on chain, track the execution of protocols. We can track data samples, data handling. We can gate access to data sets with a token or other gating mechanisms to allow researchers or AI agents to extract value and create value for that community's data. So there's all these ways that we can make Web3 actually really work in crypto, or in biotech. But I think what's really going to create just sustained energy and sustained interest is some kind of marquee biopharma partnership where biopharma buys in on blockchain in a public way. And that can be really around decentralized trials and around data ownership, data transfer, data patient data sovereignty, and then, rewarding and incentivizing patients to participate in research, still being ethical, but where, it's cash in pocket, but where, essentially when patients share data and share it as community, that's the goal. That's where the IP emerges from. And so we want to be able to make sure that there is the ability for those communities, those data providers to be rewarded for that contribution, so especially when it leads to something commercial and everyone else gets to partake in the upside. So I think we're biotech and crypto in some ways. It's a startup. It's also kind of a fund because it's really, technically Utopia is not a lab. I don't have a office anywhere. I'm calling you remote. I'm a digital nomad. So like in that sense, it's operating more like a fund than like a traditional biotech brick and mortar company, but it's sort of a platform of platforms, right? It's about these protocols that allow for financing, putting IP on chain, allowing for transactions around that IP. A big pharma partner who is going to maybe be initially skeptical, or maybe there's a forward thinking pharma management team out there that's like, wow, crypto, blockchain, we need to make a bet in this space. Maybe there are already potential buyers out there who want to eat up this narrative of DeSci, and they just want to make sure there's a competent team around it. Ultimately, it doesn't matter what you call it. They're going to be judged by how many significant figures are there to the revenue in this deal, because that's the markers of success in biotech financing and trad bio. First step is kind of the financial recognition, and then the next step is the clinical validation. So I think Utopia is going to have to get through the best of Web3 stuff and do the best of the trad bio way, honestly, and kind of fuse them together right now, and then start to more intently involve toward a fully Web3 system of like all research being governed by protocols and even peer review and things like that, with ResearchGate or others. Every aspect of the scientific research process from the lab to the clinic would be on chain. That's the utopia we're building toward. But again, I just want to be realistic about how we get there. And maybe to some people we'll be making concessions or not doing Web3 enough or not enough governance or not. But I think it's ultimately like, what serves the purpose of putting DeSci on the map?
Yeah, I think getting any big pharma company behind this would add a lot of credibility. And you're right, like there still needs to be a lot of collaboration with the current system. For your case, like repurposed drugs, they still have to travel through a very centralized, risk-averse FDA pathway. How do you see a DAO like Curetopia navigating that tension, basically? Which stages of the drug development pipeline can be community governed, like genuinely community governed? And where do you think traditional centralized models will have to hold the upper hand? I guess my question is basically, can clinical trials be fully decentralized at some point, and how could we get there?
Yeah, I mean, that's definitely, we're going to start with N of ones and take the playbook we've developed at Perlard over the years with families and take these N of ones and put them on chain. And so that will be kind of the first baby steps in that direction. But ultimately, it's going to take time. And I think, where does governance and community participation really make sense? I think it starts to make sense once we frankly get to like clinical candidates. I think the scientific journey that leads up to there requires a lot of, frankly, either pre-existing expertise or the ability to kind of learn a lot of stuff about yeast technology and other things. And frankly, people are busy. We live in an attention economy, and it's very difficult to break through for sustained periods. And that's just the feature, not a bug. And so I think what I've kind of learned empirically is, at the end, in the beginning of the scientific journey, before we get to the clinic, before it's like real people affected, then only the most expert people really should be commenting. Everyone else, if you're kind of more in a learning mode, then you can kind of soak in the information. But like, my job is not necessarily to be teaching you. We can do marketing, other things to make this accessible. But like, if you want to really learn and contribute to the scientific conversation, then it's kind of like there's a burden on you. It's not just showing up and saying, hey, I'm part of the community, or let alone if you don't even hold the Cures token. Like, you have to sort of earn community. You have to earn the right to be listened to. Everyone can be heard, but not everyone should be listened to. So I think that's the difference we're trying to finesse here. And then I think, yeah, a lot of people in the Curetopia community are also putting a lot of trust. The burden should be a lot higher, and a lot of people should be asking a lot more questions. But I come with this reputation and history and experience and repeat founder scar tissue. And so that has afforded me, I think, a lot of trust from the community, which obviously I need to spend wisely. So I think that's kind of the view here. If you're just doing the DAO and the performance just to check a box and say you're doing it, then you're probably not laser focused enough on the science, frankly, which is what drives all of the value creation in anything, whether it's a DAO or an LLC or whatever the structure is. So what creates the real value for Curetopia is amazing data, amazing science, and that will open the door to partnerships, open the door to clinical. Repurposing can allow us to just take many, many more shots in goal. But I would say people shouldn't sleep on repurposing. We're actually, and this is the non-obvious thing that hopefully I'm making more obvious by saying it out loud, that repurposing is actually this giga training set for Gen AI to then do next generation enhancements of these existing molecules. Because you could just start from scratch in chemical space, and AI will allow us to do that, of course. But I think in many ways we're learning that the drugs that already exist, including naturally occurring molecules, vitamins, supplements, plant products, these are all potential starting points for novel derivatives that could be enhanced and or take a function or a pharmacology that was a sort of a minor pharmacology in the parent compound, and now elaborate that, make a next generation molecule that is all about that, now make it its day job. You can see so many places where you could start repurposing and branch out, and you wouldn't have that cold start problem. I think repurposing is this amazing training set for Gen AI drug discovery that most people don't see it that way. They just see repurposing as sort of this charitable or scientifically dead end. It's just something palliative, something out of desperation almost, something with capped potential. But if you see it actually as this raw material that you can then train AI, and that the molecules you're training with are also the starting points for novel chemical matter, there's just so much opportunity there that's sitting on the table.
Yeah, I feel like a lot of people talk about how can AI augment the value chain in biotech. And there's a lot of different ways: drug discovery, drug repurposing. There's companies out there doing it already. The stage that we're at right now, that actually seems like the use case where AI can actually work, because we haven't seen any native AI drugs to market yet. There's candidates. And the latest stage one is in phase 2 right now
I
in
think it's in
silico.
silico, man.
Yeah, so that's pretty good, but we haven't seen any like native AI drugs yet. But I think this is like a real use case where AI can just be like very successful. But yeah, like, I guess speaking of that, and probably the last question that we'll get to, I've been thinking a lot about recently Like, what is going to be the AI of biology? What in biology research or science research is going to transform the way that we think about human life or disease or anything related to health, right? My question to you is, what do you think is the equivalent to biology that AI is to software?
You can't spell air without AI. If you really embrace that, you realize that AI is not augmenting. You asked just like before, where does AI augment value in the value chain? And I'm not sure, that's not how I think about it. I think about it more as each individual operator, starting at the founder CEO level, if you're embracing AI and ingesting it versus not at the frontier of where the frontier models are, then you're not augmenting yourself. And the AI sort of bio is not going to, I would frame it more as, imagine if every scientist CEO is now AI enhanced and AI augmented. So every step of every element and every minute of their day is AI enhanced, right? From agents that will handle their email to agents that will do scientific queries. You have a random thought during the day. And then if every scientist CEO is doing this and they're networking with each other and teaching each other, hey, I just realized this hack. And then as the frontier models themselves just keep pushing the boundary of what's possible, and we get to true AGI, which is, I think, right around the corner, then if the founder and everyone in the company, the culture is like, well, you're going to be sucking from the fire hose of AI. And if it's not part of every workflow that you're doing cognitively, scientifically, operationally, then you're basically just going to be outcompeted by the person who is incorporating it fully. And so that's the way I think about it more as, imagine now, this is kind of playing out with Curetopia. I could start Curetopia as a solo founder. I can stay solo longer because of AI. I can now incorporate the frontier models into my scientific reasoning, where I don't go to PubMed anymore and try to kind of intuit what the keywords are and read the minds of other scientists of how they would phrase deeper concepts beyond just keywords. And then like move into a place where I can now have conversations with ChatGPT. I have to fact check it, but now that becomes the way I think about my data. And yeah, I think people started to do that a few years ago with the first LLM drop and they're like, this is hallucinating, this is stupid. But now it's like, if you're not awake, you're realizing now is exactly the moment when the wave is starting to crest and where AGI is going to be there. And do you want to kind of be on shore with the wave sitting down on you, or do you want to be riding that wave? And so I think every founder, every scientist, especially scientist founders in biotech, it's like the AI of bio is like a generation now of scientist CEO founders who are AI augmented. And then of course their operations will be AI augmented too. It starts with, think about it as, you have to augment yourself. You have to be fully augmented and fully AI immersed. And then from there, that productivity gain is going to cascade. And like everyone in your team is going to be operating that way. And then you're going to work with more other companies that are kind of operating that way as well. And then within a year's time, anyone who hasn't kind of caught on to this wave is going to be blown away, left in the dust. And so it's not about this tool or that tool. It's that you are the tool and how AI is going to enhance you. And if you haven't figured that out, then someone else is, and they're going to outcompete you for money, for capital, for customers, for patients. So get on it now. And I've been saying this on Twitter, like, go all in on AI. And like, of course, AI skeptics. It's like, no, if you're not getting that every aspect of your performance is going to be augmented by AI, get on that, because you will, like evolution, be outcompeted if you do not eventually jump on this train.
Yeah, that's insane. The productivity that AI has allowed. Like even in my lab, you were saying that like sometimes I'll just ask it to, hey, draw me up a protocol, and it's pretty good. Like I can almost follow it precisely with a few adjustments here and there, but I don't even have to think about that anymore. And so even at the early academic stage, like it's helping me create experiments, it's creating graphs for me, analyzing my data. To that level of productivity just lets me do more work in the day. And I think that will be really crucial for early stage founders who are having to do a lot of the grunt work by themselves, and can maybe allow them to stay solo for longer. We don't have a lot of time, so I'm probably just going to ask this last question and leave it at that. We've been talking about AI, we've been talking about AGI. People have very early timelines, right? And some of them are by the time I graduate, which is 2027. What do you think that's going to change about the types of companies and the types of startups that people should be thinking about building? Should I, as a 20-year-old right now, if I wanted to do a startup, should I be making an AI native startup? Or do you think that it's still okay to create companies where AI is part of it, but not necessarily the main tech component?
I would not even think in terms of companies at this point. I would think more in terms of projects that if a certain result happened, they could become instantly companies, or at least businesses that can generate some kind of revenue or cash flow. And imagine that you can be running multiple ones of these projects. The frontier models, you can kind of come up with a set of hypotheses, and then even using existing CROs, and eventually with the right automated robot labs, you can imagine that you could be running a couple of very lean, capital efficient experiments. Maybe they're 10, 20K a pop. And you're like, well, where am I getting that money? And this is where potentially with crypto financing, especially small dollar amounts, high risk, I think that sort of describes every meme coin that's ever been made. So you could start to imagine a world where, or pursue grad school if you really just want this safe space to just cognitively explore and just have that freedom for should be done in 3 or 4 years. I think PhDs, in Europe are 3 years or whatever. So you're going to be spending 5, 6 years doing this now. But, and if you didn't want to go to grad school, then figure out some way. So there could be some clever crypto ways to kickstart this, or just do some kind of consulting or something where 10 grand here, 10 grand there, and maybe you can run this little experiment and this project. And maybe you just take a corner of biology and you go at it and you're passionate about it. You somehow solve this problem that no one else has solved, and it leads to some kind of product. The project goes to product. I think that is where I would be encouraging people who are super young is think about this project to product pipeline and don't worry so much about company formation. I mean, in science, there's just so much risk that, you could set up a company if you're in an app or whatever, doing something software based, because if it dissolves, it's gone. But like with science, it's just, you don't know where things are going to go. You don't even want to commit to a company structure, I think, until you absolutely need to. So what are all the various projects that if with 1 or 2 killer experiments, you could have a product or an MVP? I think that's where it's going to be like to be a young first-time founder. And you're going to be a first-time founder, but with building with all of this wisdom and the wisdom of all your other founders who have come before you, you're going to be able to tap into that collective wisdom. Being a founder of the future just means you're going to be able to just start your career taking a lot of small, high ownership bets. And then if they pay off, you're just going to, I don't know, you're just going to see where the science takes you. Imagine if you're, just starting out, way more digitally native than I even was. I still remember touchstone phones and voice machines, answering machines. But yeah, someone at your age and just in the next few years and just building in this place where AGI is just going to be in the air. Oh my God, it's just incredible.
Yeah, that's so awesome, because building the company is the hardest part. And you have to be so certain about your idea before going on that journey. But it's the human component of it, right? There might be a future where that's all I have to do is come up with ideas. And then a future where I don't even have to come up with the ideas. You just need a really good execution person, right? Like ops. And so, yeah, that was really great.